Thanks again, Dr. Kathy Hughes, for talking to the Op Report. Tell me about the I Look Like a Surgeon hashtag campaign on Twitter.
Well, that started through a Twitter hashtag. I look like a surgeon, um, basically inspired by the hashtag I look like an engineer. There were two surgery residents from the University of North Carolina, Heather Logie, talking to her friend Sarah Scarlett, and texting back and forth in response to the campaign and thinking that, oh, gee, wouldn't it be great if there was a I look like a surgeon hashtag and putting up pictures of women surgeons. Heather started tweeting. She followed it with a blog, and um, Alison McCoubry picked it up in Northern Ireland immediately. She was the first person who left her photo up. There were a couple people that put them up and then took them down right away, and it just has. In fact, I was actually texting with Heather, proofreading the blog post right as she put that up, and promised her I would boost, and the rest is history. It just has exploded.
Yeah, it's really exploded. I watch Twitter activity, or I watch social media activity among surgeons pretty religiously for the past few years, and this is by far the biggest burst of activity I've seen, including sort of the conversion of to Twitter users who don't usually create any content to getting people onto Twitter. It's really been nice to see. Now, what do you think it is that's resonating so much and getting different level of engagement?
Well, I think there's a couple things. First, this is a really positive message. I mean, it's not complaining or hitting people with like this isn't good enough or that isn't good enough. It's not complaining. It's making a very positive statement about I look like a surgeon. I am present. I am here. Anybody that does surgery and is doing it well looks like a surgeon. It embraces more than just gender. It touches on diversity, and it's inclusive of everyone who's a surgeon. So I think that being a positive message is really important, and I think it resonates deeply with women who make up better than 50% of the general population. They're better than 50% of college students. Many medical school classes for a while have been better than 50% women, and yet the numbers tail off as we get into surgery, and then as you raise the ranks of leadership and responsibility. And so these are the atmosphere that women surgeons are practicing in, with many of the issues that go along with that. So you're aware and sensitized, um, but embracing it with a positive message is an easy thing to do. This isn't tearing anybody down. It's not pointing the finger at anybody. It's just declaring that you're there, and I think that is always an attractive way. Maybe not an easy thing to embrace.
Yeah, and I sense a hunger for change through to the people on this in this campaign, and I see a few sort of related goals that people seem to have. Can you talk about what some of the themes coming up?
Well, there is a hunger for change. I mean, every revolution starts with conditions that have been going on for a while, and I think we're, 2, 3 academic generations, maybe more, into having more than one or two women in surgery, and each generation along the way is hoping that they're changing it more palpably for the next generation, and not seeing as much movement as we would have anticipated. There has been movement, I think, certainly at the level of conferences, both in topics of discussion and attention being paid to inclusion of women and diversity is on the radar. But there are still very tangible things that and issues to address. There's still a wage gap. There's still a big disparity and gap in entry-level surgeons, and then who you see in leadership. And we share this with a lot of professions that have traditionally been male-dominated, and into where women have been practicing, whether it's law or engineering or in the tech industry. So this is a real opportunity to engage and move the conversation forward, and perhaps this has been recognized and acknowledged, and now it's time to perhaps move it into action.
Yeah. So how do you foresee moving from a social media campaign into some actions people can take?
Well, one thing that's been really nice and gratifying is to see that so many of the institutions that we need to engage in helping change the culture are paying attention to this and are involved and participating. And it's so much easier to have the conversations and to put things into action when all of the players are present at the table and have buy-in. We're seeing the colleges, like the American College of Surgeons and the Royal College of Surgeons, also tweeting out in support of this. We're seeing residency programs and educational institutions and hospitals tweeting in support of this. There's media attention, so it's been accepted and embraced by the general public. I started the Facebook page, and I think that there are at least as many non-physician people that are liked the Facebook page, following the Facebook page, commenting on the Facebook content, which is drawn from the Twitter campaign, which shows us that we have allies inside and outside of medicine, and so the general culture around us, as well as the surgical culture that we are part of, all of the players and stakeholders are we have their attention, and they're
Indeed.
in the same
Yeah.
space. They're part of the same community, and that's what you need to catalyze the meaningful interaction to translate into actionable items.
Excellent. Well, I look forward to seeing where the campaign on Twitter and now on Facebook take us. Very good. Thanks for talking again, Dr.
Great.
Hughes.
Thank you.
Take care. Bye-bye.
Bye.
Thanks for checking out the Op Report. Help us keep conversations alive on topics in general surgery. Check out more episodes of the Op Report and other OnSurge content here at YouTube. Find us at Facebook. Follow us on Twitter. And find our homepage at onsurge.com. Join the conversation and tell us what topics you'd like to hear about and what people you'd like to hear from.